I've been a surgeon for 40 years, and my wife had been suffering from some severe inflammatory bowel disease for decades, and it really affects your lifestyle tremendously. And she was put eventually on some medication that was $2,100 a month, and it did absolutely nothing. We were traveling out of state, and we got a call after one of her colonoscopies, and he gave us the news. He said, "Your colon was so inflamed, I could not pass the colonoscope into the small intestine. So I took blind biopsies, and luckily he did, because they found that the inflammation was so severe, some cancer cells were forming." Well, about 2.5 years ago, we started using the X39 patch. And every 6 months, Leslie was getting a colonoscopy. And on her fourth colonoscopy, the doctor came into recovery and he says, "What are you doing?" She says, "What do you mean?" He says, "I've been a doctor doing this 32 years. I trained at Harvard and Tufts. I've never seen anything like this. Your colon looks like you never had this condition." And I took biopsies. "I'll call you in a couple of days." He called back and he said, "Biopsies showed normal colon." And this has happened sequentially for several colonoscopies since then. And she had one a couple of weeks back, and he came in and he said, "What's that Z thing you're using?" She said, "It's not a Z, it's an X39. So I use it in my practice to help increase copper peptide and collagen levels to strengthen the walls of blood vessels for patients. So it's actually age reversing in that sense. And people who are prone to getting heart attacks and strokes, I think it's buying them extra time. I
Yeah.
mean, it just makes sense. And we can see patients with spider veins, their spider veins become less visible over 6 or 7 months because they're putting more collagen in that vein wall and making it thicker and more opaque. So these benefits are readily visible. So the positive effects of this, I think, are better than any prescription medicine, that I've seen. So I think it's an ingenious invention. And even though there's been decades of light-based therapy research done, Dr. Michael Hamblin at Harvard had decades of research on this. But what the genius of David Schmidt was in shrinking this down to a wearable, portable device that's affordable and anybody can use it. So it's accessible to a whole lot of people. And I think really that's the key.
And X39 stem cell activity patches is my new thing that I'm using now to heal people faster. Let me show you about this. So this is now some before and afters of patients, and let me show you using the X39 how this helped. So these are 3 patients you can see without the patch, with the patch. So we have 2 patients with the patch, 1 without, and let's follow them forward. This is beforehand, okay? This is 6 days after. Now, without the patch, you see that redness? That's what I'm used to seeing in patients. Now, with the patch, this is 6 days after. Look how little redness there is in the face and less yellowing of the skin. These patients look like a month after surgery, only 10 days after. And this is the power of the X39 patch. And here we can see the way that 10 days look like in these patients with the patch looks like 5 weeks without the patch. So they're healing much faster.
We've been using it in my practice for over 2 years now. I got over almost 200 patients now. And we track all of our outcomes, which means that if you become a patient in the practice, you'll have an exit call. So I know exactly how well everybody does. We patch every patient in the practice because of the results we get with them. And it's just really hard to get my attention because we get a lot of people asking us to look at their product. And there's a lot of bad product out there. I mean, a lot of bad product. Supplements, medications, medical devices, light therapy devices. This is one of the good ones. We just had rave reviews from the patches. Stuff I wouldn't have believed possible, like scars disappearing, or, like my mom's case, just this crazy pain and depression that disappeared on the patches. She didn't even realize it. She didn't know what was doing it. The patches were.
I've been in chiropractic for 30 years. And as you can imagine, a lot of people have come in my office telling me that they have the greatest and the this and the that. I've used a lot of supplements. We've used a lot of technology, light therapy. And so in my mind, I really thought it was more of a placebo. But when my friend told me that there was over 20 years of research and over 200 patents, I thought, that's interesting. So I took a look at them and said, hey, if there's research and there's patents, it's got to be real. So I patched myself and I hope for the best. I was turning 60 and I thought, you know what? I want to lift heavier this year. I want to be better. I don't want to get more and more old. So I had taken a picture before, and about 90 days into it, I thought, you know what? It was all the way through the holidays. I'm going to take a picture because not only was I sleeping better, not only did my knee give me less problems. So I looked at these pictures. I'm like, oh my God, the only thing I changed was putting these patches on, and I was consistent every day. But guess what? It didn't work in 2 weeks. It didn't work in 3 weeks. It didn't work in 8 weeks. I mean, it was working, but had I not kept going, I would have never seen this. And it just gets better. I get stronger. I'm lean. My muscles are better. I have more energy, and it's getting better and better every day. So I love this.